from where we had stopped. So last we were talking about hemorrhoids. Hemorrhoids and what are all the probable remedies and how do we approach to hemorrhoids. Okay, light off now. It's better now? Okay. It's been recording on there. Okay, no problem. We'll see. Okay, so we were trying to understand approach with cases. Okay, and I had shared one case. Probably we discussed two cases in the last class. One was a case of a guy who developed hemorrhoids after consuming alcohol and eating spicy food. That was one case where we had given him Naxvamica with good improvement. And then I had also shared another case of Nitric to a young lady we had given. And then one more case we had discussed was case of hemorrhoids. So three cases with remedies we have discussed. Okay. So we'll be starting with another, the last group, the task for the last group. Here, actually I'm treating a case of MS, multiple sclerosis. Okay. She's a very young girl. And her father who had accompanied this patient had a small request, and the request is, sir, my wife is having some problem. Okay, I have not got her along, but can you please talk to her and can we have a remedy based on the telephonic conversation. Okay, and it does not work that way homeopathically, but then I said, okay, we'll talk, we'll at least understand what the problem is, and then we can decide if we can really take up the case or no. So when I spoke to her, she complained of a small swelling, and she had painful stools and a small swelling. And in our local language, the swellings that she described was like kadlekai. Okay. And what in English we call this as groundnut, peanut groundnut. So this is the information I got, and if at all you want to ask many more questions, So what are all the questions that comes up here is, she had a swelling, very small, there was no bleeding, this is very important, and it was painful and a little amount of backache. So this is the small totality I got over the phone. Okay. So keeping this scenario in mind, how do you analyze a short case? How do you conclude? What are all the probable rubrics that you take up? Hemorrhoids with backache is, you have some 8-9 remedies in our Materia Medica. Hemorrhoids with backache. So what are those remedies? Aesculus is one remedy. You also have Kali carb, and then tumor. There are 4 remedies mentioned. Hemorrhoids accompanied with back pain. Anyway, we'll see that it will come up. So, what are the questions? So one of your friends says hemorrhoids with backache. Yes, it's a possible rubric. Anything else that you can think of? Okay, hemorrhoids, groundnut like. Do we have a rubric like that? No bleeding. Okay, hemorrhoids which does not bleed. Okay, there's no bleeding. So what is the term we use when you have a patient who has hemorrhoids which does not bleed? What is it called? Blind. Good. Blind piles. So you have a sub-rubric in your repertory under the chapter rectum, hemorrhoids blind. So you can take that. So I took blind hemorrhoids. I took hemorrhoids accompanied with back pain. And one more doctor contributed something, but she has a question mark. So has homeopathic literature got anything to do with groundnut? Okay. So luckily, you have a rubric, hemorrhoids groundnut like. Fine. The rubric is hemorrhoids groundnut like, and you have a single remedy. And the single remedy is what? That will come up here, and this is where the rubric is considered. If you just see here, hemorrhoids blind, hemorrhoids groundnut like, and hemorrhoids with back pain. One more rubric I forgot to take here is painful. Hemorrhoids painful. So if you Consider this small totality. What is coming up is Aesculus. So this lady was prescribed Aesculus hip and she beautifully recovered. Okay. Rarest of those cases where we don't see the patient and we prescribe, and I took up this case because of that catchy word. I was very curious, and when she said kadlekai tara, groundnut, and that's when I just typed groundnut, and Aesculus is the only remedy. I did not want her to miss the opportunity. So gave her Aesculus and she beautifully improved. Okay. So now, what is that we all know about Aesculus? As a homeopath, you know that this is one of the top remedy for hemorrhoids. So what other information can you contribute related to Aesculus? What else? Related to hemorrhoids? Huh? Okay, sensation of sticks. See, there is dryness in the rectal area. Fine. And that dryness is something that is many times expressed by the patient as sensation of sticks. Good. Sensation of small sticks in the anus. Yes, absolutely right. I mean, there is another remedy which also has this stick-like sensation. Collinsonia. Very good, Collinsonia. So it's not only Aesculus, you also have Collinsonia, which I'll be dealing, if time permits, a little later. Okay. What else? So Aesculus, you have hemorrhoids with sensation of small sticks. Aesculus, hemorrhoids accompanied with backache. Very, very top remedy. Very important. Concomitant you have in Aesculus. Okay. So the issue is with okay. So we'll just have a look, but anyway. Yeah. Okay, fine. Anything else? See, if you read good books, Clark, Dr. Boring, Dr. Fatak. Okay. So the first very important paragraph, what they mention about Aesculus is, the action of this drug is more marked on the lower bowel. Please remember, more marked on the lower bowel. So when you say lower bowel, from the knowledge of your anatomy, you know what the structures are and what the possible pathology is. So the possible pathology that you see is, it acts on the lower bowels, it acts on the veins of the lower bowels, it causes engorgement of those veins, and the final results will be hemorrhoids. This is the pathophysiology of Aesculus action. Okay. So this is Aesculus. I will not go into the details, and we saw that the hemorrhoid symptoms is what we are trying to understand. Hemorrhoids, if you have to describe, they are blind, painful, very important. These are all the keywords. Okay. Ruling. These things are to be there if you have to prescribe Aesculus. So purplish, burning, and this last line is very, very important. Rarely bleeds. You have one more rubric where Aesculus is mentioned. It might come up in the PPT, I am not very sure, but very painful, seldom bleeds. Hemorrhoids, very painful, seldom bleeds. Very rarely bleeds. Single remedy, Aesculus. There should be pain and there should be very minimal bleeding, or there is no bleeding. Okay, this is very important. Exactly opposite of nitric acid and many other bleeding hemorrhoids. Okay, so very hard stools, constipation which comes from portal stasis, hard, dry, difficult to pass with dryness and heat in the rectum. We just discussed that. Followed by fullness of rectum and an intense pain in anus for hours. Pain is predominant, and the rectum and portal system are very sensitive, especially to the effect of this remedy. Meaning, we are focusing on the sphere of action. This is the main area where Aesculus acts. Okay. See now again, this is what one of our friend was talking of, like groundnut, and I have highlighted single remedy in our materia medica is Aesculus, like groundnut. Okay. Very painful. Yeah, this is something we are repeating. So the sensation of stick, as if it is filled with small sticks, dry, uncomfortable feeling in rectum as if filled with small sticks. Hemorrhoids during pregnancy, hemorrhoids during menopause. And we are talking of pain. Okay. So a sensation as if knife-like pain shoots up the rectum. Knife-like pain shoots up the rectum, not able to walk because of painful hemorrhoids. Not able to walk because of painful hemorrhoids. Okay. See, you have to remember, because we'll be talking of another remedy. So when they are in pain, how do they behave? That is what is individualizing one remedy from another remedy. So here what you see is like, there is so much of pain that they have difficulty in walking. We'll talk of another remedy a little later. Yeah, this is what our friend had contributed. Hemorrhoids accompany backache. Okay. Fine. And few characteristic modalities. The only remedy mentioned: aggravation winter, amelioration warm weather. Aesculus. Hemorrhoids, aggravation winter, hemorrhoids, amelioration summer, or hemorrhoids, amelioration warm weather is Aesculus. Okay. So this we have already discussed. So this quickly skip, and we'll look into the other remedies. See, we were talking of a remedy in which there is no bleeding. Okay. Now we will look at another remedy in which bleeding is something that predominates. Okay. So one of the top remedy for bleeding piles. What remedies come to your mind when we talk of bleeding hemorrhoids? It can be Collinsonia, it can be nitric acid, it can be hemorrhoids. Okay. We are talking of phosphorus, belladonna, yes, all those remedies. Now, what is important for us in nitric acid? When do we think of nitric acid? One clue I have already given. Hemorrhagic, pain remains long. So it is a better remedy for fissure. What is it? It's a better remedy for fissures when you are talking about pain. But in hemorrhoids, we think of nitric acid when there is more of bleeding. Bleeding and of course pain, I don't deny. But the pain which remains for longer hours after stool is a common symptom of fissure. Focus is hemorrhoids. So what we see here is a beautiful rubric I found in the repertory. Hemorrhage from anus after removal of hemorrhoids. Okay, meaning the bleeding per rectum after hemorrhoids are operated. After the hemorrhoids have undergone surgery, after the hemorrhoids have been removed, you see bleeding. Okay, single remedy is nitric acid. Post-surgical, indications. We have so many remedies now. What are the remedies post-surgical? Cephalosporin, opium, bismuth, camphor, acetic acid. Fine. Acetic acid is mainly for bad effects of anesthesia, and bad effects of mainly spinal anesthesia. Okay. Like for example, if there is the back pain after spinal anesthesia. Fine. We generally think of hypericum. We generally think of leadum. You can also think of acetic acid. Phosphorus. When do we think of phosphorus? Post-operative vomitings. Okay. Stephysagria. Beautiful remedy. Bismuth. Calicel. Okay. What is the indication in calicel? After tonsillectomy, what will happen in calicel? Okay, no problem. Anyway, we'll take it as an assignment. Calicel. We can look at calicel. Okay. Any other remedies? Bellis. Fine. Post-operative. Deep abdominal operations. You can think of bellis. So here remember nitric acid. Specifically after the hemorrhoids are removed, a person will have bleeding per rectum or hemorrhoids from anus. Fine. Okay. Now hemorrhage which is bright red, it is not clotted, bleeding after every stool. You know this is what you have in nitric acid, and nitric acid also has hemorrhoids which are large, mainly external hemorrhoids, painful hemorrhoids, largest compressed, touch and walking occurrence. Okay? Cutting pain in rectum. We saw that you were also talking about the pain, which is very characteristic in nitric acid. Okay? See, and one more thing you also have to remember, nitric acid has an affinity for mucocutaneous junction. Okay? Fine. So hemorrhoids, that is, see, this is about nitric acid. In my clinical practice, many cases successfully treated when they are more of bleeding, bleeding hemorrhoids. Okay. And now hemorrhoids in children. Okay. Hemorrhoids, children or emaciated. Both. You have a remedy. And what else you know about this beautiful remedy, muriatic acid? Protrudes? Okay, protruding, hemorrhoids protrude while urinating. Better remedy? Baratakar. If the hemorrhoids protrude after urination, which is the remedy? This one remedy is single remedy and that remedy is murk. I'll come to it a little later. Hemorrhoids protrude after urination. Hemorrhoids protrude during urination. Better remedy is Barata, and you also have muriatic acid. Okay, what else about muriatic acid? Okay, very good. What is that sensitivity you have in muriatic acid?
Cannot bear clots.
Okay. See how the books give, and I mean these remedies were proved in the Western countries, and they use tissues to wipe. So what is the explanation, or how is it mentioned in books is they are sensitive even to the softest tissue. Fine. So the hemorrhoids, in muriatic acid are very, very sensitive. Okay. We had a case of a young lady who had very sensitive hemorrhoids, and she beautifully improved with muriatic acid. And muriatic acid also has something very interesting. Okay, warm application, but more than warm application, hemorrhoids appear suddenly. Many remedies which have sudden onset. But what is it that is sudden in muriatic acid is hemorrhoids. Out of the blue. Sir, I don't know. Morning I just passed motions, it's absolutely fine. And afternoon I landed up with hemorrhoids. That suddenness is what you have in muriatic acid. This is what I wanted to tell you. Hemorrhoids protrude like bunch of grapes. You know a better remedy, but I also want you to remember this remedy. Because in the same case, we had tried with aloes with no improvement, and then keeping the sensitivity in mind, we had thought about this particular remedy. Okay? Hemorrhoids protrude while passing urine is what you told. You also have two more other things. While passing flatus, so weak it is, even with flatus it is coming out, or during stool. Okay? Sensitive, purple, swollen, painful, and this is what we discussed a little while ago. Sensitive to the softest tissue. Okay, and only remedy mentioned hemorrhoids under children, and aggravation motion, parturition, and touch is something very important. There are problems washing, there are problems touching, because it is very painful. You can think of muriatic acid. This is muriatic acid. Okay. So moving further, few more remedies indicated for hemorrhoids we'll be looking at. From congestion of portal and pelvis in women. A remedy which has hemorrhoids coming from congestion of portal and pelvis in women. Hemorrhoids after hard stool. We had a case. What did I discuss in that case? What had happened in that case? There was bleeding after hard stool. Here what do we have? We have hemorrhoids after hard stools. So lady or the patient will have hard stools, and after hard stools, he or she will have hemorrhoids. Single remedy, and that is the remedy which will be coming up a little later. After heart complaints relieved. Okay, Collinsonia. After heart complaints relieved, or used as a prophylactic for rectal operations to prevent any further complication. See, assuming, you tried, you could not treat the patient, and patient wants to go for surgery. Okay? So this remedy can be given as a prophylactic to prevent any further complication. So hemorrhoids associated with loss of appetite, indigestion, skin lesions, all single remedy. Single remedy rubric. Chronic painful bleeding, piles. See, we are talking about sensation of sticks now. Fine. Which was the remedy we just spoke? Aesculus. So Collinsonia is also a remedy which has sensation of sticks. But how do you differentiate Collinsonia from Aesculus? Collinsonia will have bleeding, Aesculus is blind. And in Aesculus you also have backache, which is very, very prominent. Okay? Now the remedy is Collinsonia. So you see a lot of single remedy rubrics mentioned in Collinsonia. Less used remedy, but if you know about this, must be you can start using it more often. Okay. Now another remedy, we are discussing about pain. So here again you see that when they have pain, they cannot walk. Is a remedy we discussed. Which was that? No. We saw one remedy, no? Muriatic acid. Okay. Fine. Aesculus. Walking aggravates. They can't stand, they can't walk. Here, in pain, they have to literally separate the nets. This is what your friend had contributed in the last class. And the only other remedy, if you remember, is belladonna. Very painful, aggravation touch, holds buttocks separately because of the sensitivity. And they are so sensitive, they are so painful, they have to literally walk in a very awkward way, and that is separating the nets. And the only other remedy we have is belladonna. Tremendous suffering, long-lasting, intolerable pain, aggravation during and after stroke. So painful it is, especially at night, he has to literally get up and he has to start walking. Okay? And you also have, only remedy again mentioned for pilonidal sinus. What is it? Pilonidal sinus, a specific remedy mentioned in our books. And mainly indicated in complications of hemorrhoids. What are the complications of hemorrhoids? Bleeding? More than bleeding?
Strangulation.
Very good. Strangulation, thrombosis. Okay. So this is a remedy which is indicated in strangulation, thrombosis, ulceration. Okay. And I was lucky to treat a case of a man with thrombosed hemorrhoids. Fine. Gone to a surgeon, and we have the notes clearly mentioned, thrombosed hemorrhoids, and he was to be posted for surgery. So, Peonia officinalis is the remedy that you have to remember. Thrombosed piles, only remedy mentioned in your repertoire is Peonia. So mainly for complications, strangulation, ulceration, or thrombosis. You can think of Peonia. Okay. So again, a small case. Recently, around 34 years old auditor. He had hemorrhoids, and one thing very surprisingly what we saw in him was hemorrhoids, pain which is better by cold water. Doctor had advised him to sit in a sitz bath. Fine, and he had issues sitting in sitz bath. Pain used to aggravate. He tried same thing. He tried putting cold water on his head, and he felt better. So one remedy that should come to your mind is Aloes. Okay. So Aloes focatina. Again, from your UG classes, it's a very good remedy for external piles, and piles which protrude like bunch of grapes, and hemorrhoids which come after purgatives, or hemorrhoids which come after suppressed eruptions. You have aloes, like bunch of grapes with constant wearing down in rectum, and it is better by cold application.
No class today. It seems you are asked to go to radiology class. Juniors.
Okay, so we'll continue constant wearing down in rectum, amelioration, cold water. So this is about Aesculus, and ailments in Aesculus other than suppressed skin and after taking purgatives. Which was the other remedy? Which had hemorrhoids after purgatives? Naxvamica. Very good. We discussed this in the last class. Naxvamica. So here, sedentary habits can also be a ailment, like Naxvamica, like sulfur, like ammonium carb, like capsicum, many other remedies. Okay. So few remedies with PQRS symptoms. I mean hemorrhoids which are having some PQRS. So during urination, this is what we discussed. Muriatic acid, I told you better remedy will be Beretta. Berettacar, and of course muriatic acid. Remedy for white hemorrhoids. We saw this, they are very pale. We saw purplish hemorrhoids, we saw dark hemorrhoids. Here the hemorrhoids are pale, not typically white, but they are not that reddish, or they are not bluish, they are not purplish, they are paler. So white hemorrhoids, yes, you guessed it right. The remedy is carbohydrates. Hemorrhoids with urinary complaints. Again, see, I am giving you all single remedy. Hemorrhoids with urinary complaints. A patient has hemorrhoids and he also has urinary complaints. A combo, that is irregular. Okay. Hemorrhoids after suppressed diarrhea or hemorrhoids after suppressed rheumatism. Very good, abroadina. Hemorrhoids after suppressed leukorrhea. Very good, ammonium ure. Okay. Abroadina. See, this is what we discussed after urination. The remedy told was murk. Okay. So riding amelioration. Nitric acid, what will happen? So here the remedy is calicar. I am talking specifically related to hemorrhoids. Hemorrhoids protrude during soft stool. A tricky question, tricky remedy. Very good, alumina. Good, no issues. Any better remedy? Single remedy. And it is not alumina. It is not alumina. How is it in alumina? No problem. See, how is it in alumina? See, alumina, they have very bad pain, no? Very hard, very dry. Later they are shouting with, there's a concomitant also, no, in alumina. My knowledge of alumina, yeah, burning, if I am right. I learnt it long back, I am not sure. Correct, alumina, okay. Yeah, then anything else? It's a very simple remedy, you are not using your, very good. The remedy is wrong, the answer is wrong. No problem. I did complete my sentence and your friend started. Use your common sense, simple remedy. Aloes very good. Aloes Think. Magnesium. Platina, very good platina. No, it's not platina. It's a very simple thing. You are not applying your brains. Not that you don't have, you have too much. When I am in doubt, I ask you people if I am right. It's a very simple remedy. At least I am happy you are thinking beyond the hemorrhoid remedies. The remedy is ignition. Oh. Yeah. I told you it's a very simple thing. You have brains, you have to apply, you have to use. Good, no issues. See, sometimes we get blocked now. We don't think beyond. Okay, one last thing I want to add here is hemorrhoids painful like fissures. We discussed this in the last class. and that is sedum acre. Now, how do you understand this particular symptom? Hemorrhoids, painful like fissures, only remedy mentioned. So for this you should have an experience of fissure. For this you should have an experience of how it pains in fissure. Only then the patient can tell. Or the patient may tell, the doctor should have the capacity to interpret, oh, this is what happens in fissure, but this patient does not have fissure, he is having hemorrhoids. There can be a combo of hemorrhoids and fissure. There it will not apply. Only hemorrhoids, but pain will be like that of fissure. Sedum acre. Rare remedy but important remedy. Okay. Now we will come to the last segment of today's presentation, and this will be about how do we manage the cases of hemorrhoids with homeopathy. See, what I just tried to tell you is the homeopathic remedies are very vast, and what remedies we prescribe from this ocean depends upon two very important factors. Now, what are those two important factors? The doctor and the patient. Fine? Okay? Doctor wants more, patients tell less. Sometimes patient is giving too much of information, but doctor is not able to assimilate it. Fine? So, both the things are possible. So, what I am trying to tell you is, we generally have a simple formula, especially in chronic fissures, in chronic hemorrhoids. When we get a decent case, once we are done with the case taking, so we try to bifurcate the symptoms into mental generals, and we also look at the symptoms, for example, what comes under the physical general, and if there is nothing available, we will also have something called as particulars. If all the three are available, we try to make a totality keeping all the three things in consideration. If the above two things are not available because of some reason, okay, then we make a totality keeping only the particular symptom. We saw, for example, bleeding, pain, hemorrhoids, internal, external. How does it look? All these things will help us in making up a totality. Okay. So, the homeopathic approach, again the dosage, the potency depends upon various factors. And when we limit ourselves to hemorrhoids, when do we repeat? What is the potency we use, or few questions that come up. See, I have kept it very simple. For example, if it is grade 1, now what is grade 1? You will have only bleeding. Fine. I generally give a dose of 200 and it will be single. For example, grade 2, what will happen in grade 2? Yeah, but it will go on its own. So this is grade 2. Grade 3, protrusion comes and it has to be manually pushed in. And what is grade 4? It is prolapsed out. So our management is very, very important. Based on the grade, based on the symptoms we decide. So 1 and 2 preferably, especially 1, it can be single dose. For example, 2 and 3 might require repetition, and 4 ideally is a surgeon's job. It's a surgeon's job. It's a surgeon's job. Okay. So this is how we decide the potency and the other things. And before we close, hope we have done justice to the objectives that we had set in. So objectives is, we have given you an introduction to hemorrhoids. How do we approach the homeopathic approach which we just spoke, wherein we consider the totality if it is available. Totality could be the totality which includes mind, body and particulars. If those two things are not available, only based on the particulars, you can make a small totality and you can prescribe. Okay. We also spoke of few remedies and its materia medica. And so the last part, what I am trying to do is, we have collected few articles, which I will be giving it, and you can just go through. I will be putting it in a PDF, okay, and we also have a compilation of rare remedies acting on rare remedies for hemorrhoids. That again we are making it a PDF and we'll be giving it to you. Okay. So that see now, for example, if you are looking beyond and if you are looking at some new learning, you can also remember that body and mind has a beautiful correlation. Okay. And here I would like to bring to your notice there is something called as German new medicine. Okay. So out of interest, you can have a look and you can apply it based on the type of cases you will be getting in your area. Okay. So we'll be having a posters and I know it's lunchtime and like the child, you will also be very excited to have your food. So please have stomach full and come back so that we start with our post-lunch session after some time. Thank you. Done? Aita.